My name's Reno. I'm a master's prepared nurse at the Age Management Institute. I function as the aesthetic nurse specialist there. I have been practicing in that practice for approximately 8 years, and prior to that I've had about 20 years of plastic surgery experience. In addition, I work as a clinical instructor for aesthetic advancements, in which I travel and teach other physicians and nurses how to inject products. A very popular non-surgical aesthetic treatment is using dermal fillers. Dermal fillers are FDA-approved products that are basically putting volume back in the face where you desire. It may be nasolabial folds, it may want more fullness in your lips, or areas around the mouth, or more volume in the cheeks. Many of the FDA-approved fillers that you may be familiar with include Juvedern, Radius, Restalyne, Perlane, Belotero. All of these are common products to put in the face to restore volume. When you come in for a dermal filler treatment at the Age Management Institute, you will have an opportunity to share with me the areas of the face that you would like to rejuvenize. At that particular point in time, I do apply a topical cream, and that will give you comfort while I do the procedures. I also apply ice to the area, which also produces a numbing sensation. The procedure actually only takes about an hour. Afterwards, I do a nice massage of the area, make sure everything is nice and smooth, there's no lumps or bumps on the face, and then you actually are free to go back to work or your other activities. As far as aftercare, I prefer you to spend some time icing over that particular evening and first thing the next morning. And I like you to lay a little bit low, no real physical activity. Just kind of enjoying your day, resting, so forth. But the downtime is very minimal. You pretty much can be back going to work the next day. Results from a dermal filler treatment are actually immediate. When I am done injecting you and I give you a mirror, you will actually already see some improvement in the face. There will be some redness, maybe some swelling. There is a small chance for bruising. All of those things subside over the next few days. I do encourage icing, and that always helps with those things. By about 2 weeks, I always bring you back for a follow-up, and at that point in time, we discuss if we need to do any touch-ups and what our future goals will be related to dermal fillers. As far as maintenance with dermal fillers, most of them are FDA approved to be anywhere from 6 months to a year. How long they last depends on what part of the face they're put in. Areas that are more mobile, for instance, any kind of filling I do around the mouth may not last as long as a fill I would do more in the cheeks or the mid-face, where it would stay put a little bit longer. But for the most part, I tell patients you get minimal 6 months, and you can get as much as a year. And at that point in time, I follow up with follow-up visits. And what our goal is, or what my goal is to maintain that look. I instruct patients, I don't want you to wait till everything disappears and we start over. I prefer a maintenance where we keep that nice, refreshed look. If you're considering a dermal filler, please consider a complimentary consult. At this consult, I will help you determine what areas of the face that you would like to have refreshed. We will also talk about the different fillers that are available on the market. And that way you and I will decide together what works best for your skin type.